thank you everyone for coming today and taking part in our series. It is my distinct pleasure to introduce my wonderful friend and distinguished Dr. Cheryl Pegus, who never lets the grass grow under her feet. She always knows what's coming next. And I'm looking forward to hearing what she has to say about what is coming next for health technology post-COVID. So take it away, Dr. Pegus.
Thank you. Great to be with everyone. Great to be with some people I've known pretty much all my life. So Loretta, Judy, thank you for everything you've done to frankly get me where I am today. So it's an honor to be back to have this conversation. I will share some information with everyone. If you could just allow me to do screen sharing, that would be great, Carrie, and I will go ahead and share just some information on telehealth, what we know, what has occurred in the past year as well. And then we can move on to hopefully do some Q&A and be able to share information with your audience. And so I will start off by just talking about digital technology and COVID-19 and what does that mean for us as we go forward. And I'll do this in a couple of different ways because people use a lot of different terms and to some extent they kind of mean the same thing today. So when you hear telehealth or telemedicine, it really just means a different modality of communicating between you as a patient and what someone who's providing care can do. And we think about it generally in terms of a physician, but you could actually do telehealth with a pharmacist, or you could do it with another care provider. So it's just really, it's an electronic means of forming that connection that you would have in your brick and mortar visit. What's also interesting is I think many people think of it as sitting in front of a computer. Lots of people do this through their smartphone. Even if you did, telephone, even if it was a telephone visit, it is still considered a telehealth visit because you're communicating and managing your health. You've made an appointment for that. And there are some rules and regulations that allow that from the regulatory aspect in the federal government. And those have been put into place to allow us to use telephone visits during COVID-19 and count that as a visit. But there are lots of things that you can do. We all use text. We all use secure chat and messaging. Those are all components of care. And even before COVID, many physicians had already started including these in how they were caring for their patients. So though you hear about it a lot now, it's been around for about 20 years and a component of care for many people, including remote monitoring, where you'll see these, right? If you go to a Walmart or a Best Buy, you can buy a scale, link it to your smartphone. When you step on your scale, that information is uploaded to your phone and you can send that to your clinician. So just lots of ways for us to be able to allow telehealth to be occurring. There's lots that's been said about telehealth, and I just wanted to ground us just in some information so we know it. There were about 1% of visits before COVID-19 that were these telehealth virtual visits. Today, it's 25%. 58% of people are totally comfortable with a telehealth visit. 76% say that even after COVID, they prefer having a visit from their home and not going back. And this is data that's really important for us because, as we say, you listen to the patients and how they'd like to receive care. And so really important for us in ensuring that we're delivering care in that manner. There've been a lot of conversations about, well, can everyone access telehealth? And so I wanted to just share some data overall because you'll hear there's a digital divide for Blacks and Latinos who can't access telehealth, or you'll sometimes hear that older populations don't use telehealth. A lot of what we do today in telehealth can be done through your smartphone, and 97% of Americans own a cell phone, with 85% owning a smartphone. And this crosses all demographics. You actually find that a lot of people in underserved communities may not have a landline, but they have their smartphone. So it's a really good tool to be able to use it as a channel for care. You also, as I've mentioned, heard that, hey, can every population, can every community take advantage of telehealth? And the answer is yes. The study that I'm citing, where you see 35% increase in use of telehealth, was actually done specifically looking at Asian, Black, and Latino populations, done by Cedars-Sinai, that showed not only did those populations engage in telehealth more than others, their outcomes improved. And so really important for us to not have set statements prevent us from going down a path of providing telehealth when we've just heard 76% of people want their providers and their physicians to provide it. And then there's just this last piece. 22% of the US lives where we don't have enough doctors in brick and mortar offices. And so telehealth is a really great way to access care in rural and underserved communities. So an important part of our ecosystem in making sure everyone has access to care. Here's some of what we know that happened during COVID. For clinicians, they learned that this was a great convenience for their patients and that patients were satisfied. They had fewer no-shows for appointments, because physicians have been worried about what telehealth will mean if we use that as much as we have people come into the office. So we learned a lot that we can now incorporate into practice. I've shared a little bit about what patients felt. They didn't need to travel for appointments. I think if you live in New York, you're aware it's a day from the subway to take off to go for your doctor's appointment from work and from other things. So the ability to do that on your own schedule really matters. You got access to specialists. So right now you may get into your primary care physician, but you hear it's 3 months before you get to see a cardiologist. You can do a televisit as part of your initial start. So really helpful for people overall. And it gives you flexibility. Many of us now, I mean, even in face-to-face practice, we have Saturday hours that we make available. But think about telehealth, where people can schedule it at 7 p.m. after they've done all the homework and had dinner. So the opportunities to give people access to care when they want it and how really matters in telehealth. Telehealth, this is just feedback, not just we've talked about the patients, but from the physicians. There's some things that are really important. I got to see the environment they live in. You can't really treat someone unless you know where they go and live most of their well-being lives. We talked about things that we wouldn't have otherwise because I was connecting with them in their home. I was able to see the type of environment they actually live in, how it's crowded, how I may be suggesting you should be doing this type of physical therapy at home. Now I know you can't do that in your environment. It gives that third lens to social determinants in helping you care for your patients, which is, it's not just my giving you a pill, it's actually me understanding how you can self-manage and keep yourselves healthy. So really important insights were learned during this time. We've done some surveys of our own population who utilize Walmart. And as many of you know, 150 million people come through our stores every week, not counting those who utilize our digital services. We have 5,000 stores across the country, and we're open 7 days a week. But what we heard from people is that 40% of them delay medical care because they've got to find time for it. That cost is a reason they don't seek care. It's not convenient, and they don't see that they've got the access. Telehealth addresses a lot of these barriers. They are real barriers. And I think going forward, we have to take that into account as we care for people. I shared these statistics with you just now of how many people's lives we actually touch at Walmart. 90% of America lives within 10 minutes of a Walmart. And we've got 4,000 of our sites in medically underserved areas, all of the places we just talked about that don't have physicians. So the ability to provide, even if it's a pharmacist, but telehealth really matters in people getting good access to care. We are everywhere. We do lots of things, not just providing clinical care, but we also provide vision, dental, which is a big deal. Think of what we provide and then adding in telehealth visits so you can reach an entire community. Telehealth is a component of the care I think we will continue to see more of across the country. I think we will make people not just comfortable with it, but we will have them using it almost as a first entry point when they've got questions, because sometimes you don't want to go to the doctor because you think, oh, this isn't a big deal. But if you know you can go online and do a chat, you might easier ask that question of, I've had pain on my left side for 3 days, where you'll wait to maybe go see a doctor and by then you're having a heart attack. Our hope is it allows you to get more comfortable and confident with utilizing a channel to ask questions. It is less expensive than if you're seeing someone in person. Doesn't decrease the ability to have a relationship with your care professional. It actually gives you additional opportunities to communicate and to utilize a care team, where right now you may see the doctor, but you're aware there's a nurse, there's a medical assistant. This is an opportunity for everyone to be able to help support in care. And so we see telehealth as really important. We see it as a component of what we in healthcare call the quadruple aim, where you take care of people, you lower cost, you improve the patient experience, and you also make sure that your team is cared for, because you're allowing them to serve patients without having to run out in the middle of night to the emergency room. This is something that they can themselves can do. So I will stop there. Thank you so much for having me. I'm passionate, obviously, about telehealth, but really passionate about allowing people to take control of how they receive care and having them do it earlier in their care journey, not when they are sick or not when they are not doing well. I will turn it back over to you, Carrie, and to you, Judy.
So Cheryl, I have a question about, there's a real problem in the country about broadband access, and in rural areas especially. And one of the things I just started thinking about when I saw the Walmart issue is how spread out you guys are. And when a patient or when a person is in Walmart, they can use your broadband capabilities. And I'm wondering if the Biden infrastructure plan is something that maybe Walmart is pushing for politically with President Biden and Vice President Harris.
So I can say Walmart is not pushing for anything with the administration. We do acknowledge that we are where 90% of America is, including in the rural areas. Actually, for many of those communities, we are sometimes their only site to even get healthcare questions answered. There is a lot that has been done in telehealth, particularly for rural communities, in making sure that you can provide care in those communities. We've recently acquired a telehealth company to continue to have those assets available to people and then allow them to at least ask questions, get information early, get care early, but also be able to connect them to where they may need a specialty service. That first entry point, though, is really critical in making sure that you're open 7 days a week, or that they understand how to access your telehealth. and that you're able to not just connect them with the right level of care, but you're able to follow up because it's where they're going to come back to, be it get their food or buy their vitamins, knowing that there's a community healthcare arena for you that can meet all of those needs is really what our mission is at Walmart. We're very focused on being a member of the community, being able to provide access 7 days a week, and then ensuring that our associates, all of the people, and we have 1.5 million associates in the US, can leverage all of our resources to care for the people who come through our doors. So really committed to that, and definitely investing on our own in building out some of these solutions, because our associates live in these communities that we serve. They are part of the community. So we hope we hear and learn from them what the needs are, and that we're able to provide it not just for them, but also for the community.
Thank you, Cheryl. If anyone else has any questions, you can feel free to put them in the chat, or this is a very intimate group, so feel free to unmute yourself and ask your question.
Well, I'm going to ask another question because I'm very curious about how much of the medical world is going to be, do you think, not just Walmart, but how much is going to be telehealth? What is going to, what's it going to look like going to the doctor?
Yeah, that's a
Anywhere.
great question. And so I'd start off by saying that behavioral health and mental health treatment, we've seen almost a 5,000% growth in telehealth in this area. And even as we begin to reopen offices, we're seeing that stick. People really like receiving mental health, behavioral health therapy through a digital platform, through telehealth. I think that people who provide that care also find it to be beneficial for the same reasons. People are coming to their appointments. You don't have no-shows. You're having conversations, not of people right after they got off the subway, ran to your office, and the first 10 minutes is kind of de-stressing. They're able to engage fully. So we see it remaining absolutely there. For some of the primary care visits where you're going in for your annual checkup, that's probably a brick and mortar experience, not just because you're getting a number of diagnostic tests, you may be forming that relationship, but the follow-ups of how are you doing on your blood pressure, being able to monitor that with an ambulatory blood pressure cuff, and being able to get some feedback, that probably can be done through a telehealth experience. And so there's a hybrid that I think you will see for a lot of these. And then there are some specialties that may over-index and use telehealth a lot more. The example I gave at Cedars-Sinai is actually telecardiology, which has been incredibly successful over this time period. There are lots of things. I am a cardiologist. There's lots of testing that you have to do in person, but a lot of the risk factors for cardiovascular disease, diabetes, high blood pressure, good nutrition, good physical activity, those don't occur in the doctor's office. They occur by you in your community. So having touch points with a team from your doctor's office, be it a nutritionist, be it someone to help you in recommending, hey, I had a problem taking my medication. What does that mean with my diet? Those are all prime and great ways to use telehealth. There's an expectation that telehealth may somehow come out to be 25 to 30, and in some communities where you don't have primary care, sometimes even as high as 40% of care going forward. But it's not for it to be done in a disconnected manner. It is sometimes for your own physician to be the one also providing you telehealth. So it's not as if it's a different group of doctors each time. It's how do you make this feel seamless so that the patient knows I will always get to see my team, but I might see them through a telehealth visit, or I might see them in an in-person visit. That's really the experience you want people to have, so they know that at any time they've got a resource and a trusted voice to help in managing their care.
It seems to me like a consumer health librarian who could be a patient educator might become parts of different offices and practices. I know nurses do a lot of educating, but it also seems like that might be another venue for consumer health librarians and patient advocates, patient navigators, that kind of thing.
It's a great point. And just so you're aware, I mean, there are practices that are doing that today. They will have a telehealth visit, and they will either have someone come in to have, be it whatever diagnostic tests or labs done. And then that team will first start off with education, and they will use someone to educate, because remember, people take in education based on how they process, they can use it in their own community. And so it has to be health literate, culturally appropriate. You've got to listen to the other priorities for someone's individual life. And frankly, we as physicians haven't always been trained in some of those skill sets. So
Right.
using a team of people who have those skill sets really matters for the success. And clinicians, physicians are attempting to keep you well and not prove that we by ourselves can do all of it. So I absolutely see growth in how teleeducation will continue, because it's critical for people to be able to have a sustained manner in their well-being, because you don't just need to hear it once, right? It needs to be repeated, and it needs to be at times of low or times when a medication has changed. You've got to come back and message, and a really great use of talent and skill sets who understand how to do that well.
Mm-hmm.
Well, Judy and team, I just want to thank you for having me. Thank you for the questions. I know this has been recorded. Hopefully we can see what telehealth becomes maybe a year from now. We have a follow-up of where telehealth is actually going and how clinicians, consumers, and others, because I think it's not just librarian for consumer education. I think there are lots of other groups who can utilize telehealth. So I see it as really a nice opportunity for us to grow and scale our resources to reach everyone across the country. Thank you so much for having me.
I agree. And Cheryl, thank you so much for doing this for us. I know that you are an incredibly busy woman, and I really appreciate your taking the time to do this. It means a lot.